Progress.
Real Country 1430 AM and 107.3 FM WRDN. I'm Brian Winnikins, and good morning. This is the WRDN Morning Farm Reports. As this morning, we are talking with Tara Haskins, and she is with the AgriStress or AgriSafe rather network, and we're going to talk a little bit about the AgriStress Response Network today. And our Newsmaker segment being brought to you in part by Compeer Financial, the Animal Wellness Center of Buffalo Valley, Annabis Silo, Osteoplastics, Synergy Co-op, A&J Agronomy, and Wisconsin Farmers Union. And Tara, thank you for joining us today. Well, first, I guess, tell us a little bit about the AgriSafe network. Tell us about that group.
Well, great. Well, I'm Tara Haskins, and I'm the Total Farmer Health Director at AgriSafe Network. AgriSafe is a national nonprofit that was formed back in 2003 by nurses and public health professionals that felt like we weren't doing enough to support the health of agricultural producers and farm workers. And so our mission is to level up the competencies of healthcare professionals to provide excellent care for agricultural producers and farm workers. And we do that as a NIOSH affiliate. And we also structure all of our work around our total farmer health model that we use.
And so with this network, it's really, is it the entire health of the farmer, from mental health to physical health and that sort of thing?
Oh, absolutely. The total farmer health model are all of the factors that play a role in farmer and rancher health. So at the center of that model is both the producer and the family, because we know that the majority of farms are family owned. And so that family structure is really important to us to consider. And it includes things such as the effects of social supports, healthcare access, the inherent hazards that just exist in this kind of work that are part of that, as well as the financial issues, the effects of weather and disaster. And so we really pull together sort of a well-rounded way of approaching health. And it wouldn't be, it would also be considered not just the hazards of weather events and disasters, but also what is the financial impact on the producer and the impact on their production. Hence, all of these factors play a role in mental health.
And so you work with health professionals, but then you also work with educators. Is it to try to find out what the farmers need or how to best serve the farmers? How does that work?
Well, AgriSafe is in the business of collaboration. So we work with organizations and groups such as universities, extensions, other nonprofits, state departments of ag. So we're very well connected on a national level with all of these groups. So we feel like with our knowledge and our relationships with these groups, we have a good handle on what are the needs of the population. But I will say that we are always reaching out to producers and those farmers and ranchers, to find out what are we not meeting. So we're very sensitive to the fact that we know we have to go to our population and find out where are we not hitting the mark.
We are talking with Dr. Tara Haskins. She's the Total Farm Health Director with the AgriSafe Network, and today talking about something new that the AgriSafe Network has developed, and just in time for Mental Health Awareness Month. It's the AgriStress Response Network. So Tara, tell us about the network.
So I'm so excited that we have an opportunity to share with your listeners. So we just launched the AgriStress Response Network. AgriSafe has been part of a large group of agricultural professionals as part of the Southern Farm and Ranch Stress Assistance Network. So we started out based in the South, and we've been doing work together since 2019. And it was expressed from the very beginning that we did not want to lose our connections within this group of professionals. We are passionate about serving the population of farmers and ranchers and their families and those communities that surround that type of work. And so we decided we wanted to go on a national level. And so we are now expanding our network, and we are inviting others to come in with us with the hope that we can share programs, resources, strategies, knowledge and expertise, not just among ourselves, but also to get that information out to the people that need it.
And so mental health for farmers, of course, something that really hasn't been talked about a lot until the last few years. So
Mhm.
obviously with the AgriStress response network, this is something that frankly is needed.
Absolutely. I've been a healthcare professional, registered nurse now for 33 years, and I've worked a lot in rural America with rural groups. And we've known for a long time that healthcare access to especially specialty providers such as mental health providers is very much limited. And there are a lot of other issues that exist in rural America. I think now that things have a bit of a spotlight on them, we're going to look to see where are some of our solutions, and they're getting there. But there are certain factors in agricultural professionals, or agricultural producers, that can be some barriers to getting help, like the sheer schedule that they have to keep in order to get their crops in, working from dawn till dusk, sleep deprivation, not being able to get away from the production in order to see a healthcare provider. And so what are some solutions that we can, bring forward, and what are some resources we can provide them so they never have to get to that point? And so that's what this network is going to really be about.
Talking with Dr. Tara Haskins, she's Total Farm Health Director with the AgriStress network. It's the
Mhm.
AgriStress Response Network from
Yes.
AgriSafe. So, Tara, how can farmers access AgriStress?
Okay. So our initial launch, now we have a Facebook page, the AgriStress Response Network page, and we invite anyone to come and visit. We are already having our network partners post some of the resources that we have, but also in the works is our webpage. And so as soon as we get that ready to launch, which should be in the next month or so, we're going to have a page that is dedicated just to the AgriStress Response Network. And we're also going to be including our AgriStress Response Network Professionals Bureau. So the important thing about this bureau is that any group or organization of people working in agriculture, they can come here, find an expert in their field. If they're working in dairy, they can see who we have in dairy if they want them to come and speak to their organization. So we're really going to try to use it to link the experts with the people and the boots on the ground.
And Tara, this is available to farmers not only in the upper Midwest or down in the South where
Mhm.
you started, but nationwide, right?
Right, nationwide. AgriSafe is a national organization, national nonprofit, and we have staff in Iowa and Minnesota. But we know that we have a lot of partners in other areas of the country. We're going to be connecting with them. We're going to be relying on their expertise for certain types of production. So yeah, this is going to be a national network. And even if we don't have someone quite listed yet on there, if someone has a request, they can funnel that either through my email, thaskins@agrisafe.org, or through our info@agrisafe.org email on our website. And we'll get you connected with someone that can help you, whether you're looking for someone with expertise in financial analysis, mediation, ranching, mental health services, any of those specialty areas, we will certainly connect you.
I guess, Tara, finally, the final question, we have the healthcare providers that are kind of getting together, but the educators, how important was the extension services from the universities to get all of this kind of put together, or at least to help you along to say, well, this is what farmers are kind of looking for, they're not looking for?
Right. Well, I mean, we're working hand in hand with those groups because they understand not only what farmers and ranchers need, but what their area needs. And so that's why it's going to be really important to us to get representation from all across the nation, all the extensions. We have quite a few, and we have good coverage in the South, and we have relationships with other extensions in other parts of the country. So we're going to be looking for those collaborations to get them part of the network, so we have a central way to access everyone. The public can access, all of our partners.
That is Dr. Tara Haskins, Total Farmer Health Director with the
Mhm.
AgriSafe Network. Again, it's the
Mhm.
AgriStress Response Network. Be looking for that Facebook page, also that website coming up here next month. You're listening to the WRDN Morning Farm Report.
Thank you, Brian.